Hi, welcome to Vitamin Junkeys. I'm Dr. JJ, and she is my co-host, Jennifer Lyall. And today we'll be doing a demonstration of osteopathic techniques by our very good friend here, Laura Disenhaus, who's a physiotherapist and an osteopathic practitioner. So Jennifer has kindly volunteered her body, her fascia, and everything else for this experiment. And today I won't be taking a vitamin. I will be acting as a helper, handing gloves at her assistant. So I will let Laura Disenhaus take it away. And
it's not really a Swedish name, but
it's not Swedish.
So I thought, there's so many ways to assess somebody. It would be difficult to show a lot of things. But Jennifer, you actually have a TMJ problem.
Yes.
So I thought it might be useful just to show a bit of the assessment that goes on, not yet with somebody. Thank you. I'll ask.
Okay, can I wear them? Should I be gloved?
Why not? It's
okay.
Join the club. But typically when someone has TMJ problems, actually my assessment wouldn't really start lying down. Usually I'd have them standing. I'd observe their posture, for sure, how they walk. I'd have them do some sort of mechanical mobility test to see how well their spine moves, right?
Should she talk? She talks tons. Should that be stopped if she has TMJ problems?
Well, it's when I work on her, she won't be able to talk, so that's an effective way to get her to stop talking.
Get going.
But just
training right away.
That's right. But just want to make it clear, though, that what I'm going to show isn't the immediate thing that we jump on with. There's sort of other things that I'll screen first, and then we get somebody lying down, and we look at some of the other things, like her cranium. So a big part of osteopathy is cranial therapy, where we look at the mobility of the cranial bones, because there's microns of movement that still exist, even though a lot of the medical community talks about the sutures being fused in our cranium. Actually, there is some mobility, and that's been proven on some tests. And it has to expand for fluid changes in the body anyway. Our whole body kind of expands and contracts.
Like when you have a fat head.
You might have a particularly
Sometimes
fat
you have a smaller head.
It changes every
minute. When you get angry, your head swells.
That's a totally different issue. I'm not going there, no.
Okay.
So we'll get back to Jennifer, because Jennifer's the patient.
Yeah, so we are very serious in clinical practice. We're just joking, just so you know.
So the first thing that I would do actually is I'd put my hands on your head, and I would be feeling for certain consistent movements, or certain movements that are supposed to be, they're consistently amongst individuals, right? Everyone has the same pattern of movement that should be there, and if it's not there, or if it's less, or if it's blocked somewhere, I can feel. And actually on you, you don't really have a lot of movement in the bones that form your inner ear and also house your jaw joint, right? So I would sort of note where I find some changes there, and then I'd actually kind of feel around to feel how tight some of the muscles are around the joint. They're kind of tight, actually. And I'm not really going to show any treatment techniques. I'm just, just show what I'm doing.
You're assessing.
Just sort of feel what the mobility is like around just some of the, the temporalis muscle. There's also some jaw muscles in here. I'm going to touch your face just a little bit. Right? Like the masseter muscle. There's buccinator. So there's just some easy techniques that way, right? And then, glove. Will you put your hand on?
Yeah, here, I'll give you a clean glove. Should she be gloved too? Should Jennifer be wearing gloves? No?
If Jennifer feels left out.
Should Jerome be gloved too on camera? Do you want to wear a glove?
Come a little bit over to me.
Put a glove on you. Make you feel warmer.
So then, in terms of, just straighten here a little bit. So in terms of then going in the mouth, one thing I like to do is I sort of go actually on the upper teeth, and I'm evaluating her upper palate and how well that moves, right? And then if I want to go right to the joint, and actually wait, there's little muscles that get tight, and we'll sometimes go in with a finger like this. I'm going to go in just along the inside cheek. Right? I would actually follow along, and I would test some of the muscles that are tight. I'm sorry, this might hurt a little bit. Like there's a muscle called the lateral pterygoid muscle that actually attaches to the disc in the joint, and I would sort of evaluate some of the muscle tension there. I'm going to take my finger back out. I'm going to put an index finger in, and I'd be feeling around some of the muscles also related to the joint to feel if there's any tenderness. And then once I had a sort of a sense of that, I would come back in. I'm going to put my finger in your ear a little bit, because I want to hold the bone that houses the joint, and I'm going to go just on your lower teeth, and I'd want to feel how well the joint itself could move, right? I'd be testing what we call accessory muscles, so accessory movements. So, how well I can move her mandible, which is the lower jaw, right? How well I can move that bone down or up or front or back, and I'd be testing ligaments as well as the capsule around the joint. I'm going to take my thumb out, okay? And so I would do that on both sides, right, and get an idea of what is tight and what I need to start to release. And sometimes you can also get a feel of what you want to start to release first, right? So really the thing that would be the tightest is what I'd go for first. But we want to get at all those structures, the muscles on the outside, the muscles on the inside, and then the ligaments and the capsule around the joint, right? Because we want to make sure that all the biomechanical structures have their normal range of motion. But then, something else we would do is if I come over here, I'm going to have you bend up your knee. I'm going to put a hand just on your backside.
Okay.
Underneath, so lift up a little bit. Can you come back down?
Do you need gloves?
No. No. But you know, like, no
It's not
gloves
that kind
for this
of
part.
test.
Just want to make that clear. No gloves. Just sort of make sure that you feel straight on my hand. Okay. And this, often when people come in for the first time for osteopathy, you know, this is often one of the first things that an osteopath does is they put their hand under someone's
On their butt.
backside. Yeah. And the reason we do that is because,
It's osteopathy.
no. No, there's a real reason. Because we want to feel how well the sacral bone, which is a major part of your pelvic bony structure, right? How well that bone, it has an inherent kind of movement, and you can kind of feel if it's being pulled off or pulled in a funny way. It actually gives a lot of information. So no matter what the complaint is of the person, we're often going here at some point when a person comes in and they're going, I'm sure they go back to work or they go home and they say, they put their hand under my bum, and they were saying, what were they doing? But it actually gives us a lot of information. So I would just be listening and actually kind of trying to feel if I put my hands here, I'm kind of gapping what's called your sacroiliac joints in the back to see if it changes what I'm feeling on your sacrum, and I could go back and feel your spine and see if there's some other structures that are tight, and then I would lift up a little bit. I could take my hand out, and that would give me just more information of some of the structures actually that affect the jaw joint from down here.
Really?
Because the jaw joint actually works in synchrony with your hip joints. There's an analogous relationship in terms of the anatomy and the biomechanics that we talk about, and just, you know, your whole spine is going to affect your jaw. Really, the jaw is kind of analogous to having a disc problem. I think in a previous episode, you know, we talked about the way that a herniated disc is the very end of a sort of a cascade of events that can happen, and that's the last thing that occurs, but people focus on that being the main problem. It is a problem, but, you know, being the cause. So with the jaw problem, really, it's more like you have all kinds of things in your spine that can get tight. Posture, emotional tension, right? Causes a lot of changes in posture, puts a lot of muscles under strain, and then, you know, there's a series of things like that, and then eventually the jaw gets tight and people start to clench, you know, or they get pain around when they're eating, and that's sort of how TMJ or jaw problems come about. So it's a series of events. So the treatment for it isn't simple, right? It isn't just going in your mouth and fixing the jaw. You actually have to go through a whole bunch of things to work on it as a whole.
It's a whole body approach.
It's a whole body.
It's a whole body approach.
Man is brilliant.
It's a holistic whole body approach. Thank you. I came up with the idea just now. Holism didn't exist until seconds ago. Well, thank you very much, Laura. So if you'd, you got a hand. Oh, we're shaking hands.
I thought you were going to shake my hand.
So to find people such as Laura, you will just go to vitaminjunkeys.com and under our Find a Practitioner's link. And also while you're there, please sign up for our weekly podcast under Join the Addiction. And I'm Dr. JJ.
I'm Jennifer Lyall.
And this is Laura Disenhaus. Take care, continue addiction to good health.